So thank you very much, Professor Pawlowski, for your terrific talk and a very optimistic talk this morning concerning the treatment, the current treatment and the future of treatment of, we can say, HCV mono-infected patients, because this was your topic. We will speak about co-infection later today. And so you are 200% an optimist, because you said that we will cure everybody tomorrow.
It's my nature to be optimistic. I think HCV infection is an easy to cure infection. The problem, we didn't have the right tools for that until now. Now we have new treatments which have advantages but also issues, especially in terms of side effects and drug-drug interactions. But what is coming next is much better. And yes, I'm very optimistic. I have no doubt that we'll be able to cure virtually all of our HCV infected patients, at least the mono-infected patients. The remaining issue will be the cost, which means that it will not be a solution for everybody in the world.
So, in my mind, we estimate that in France there are around 500,000 HCV infected patients.
A little bit less. It's around 350,000. Yeah.
Okay, 350.
Which is a lot.
Which is a lot. Do you have any figure of how many of them do not know that they are infected?
Well, France has done a very good job in identifying the HCV infected patients, and approximately 60% of our HCV infected patients have been identified as HCV carriers, meaning that still 35 to 40% do not know they are infected.
Okay, and the next question is, do you think that we have now with these tools to propose treatment to each of them, or do we have to wait for a little bit of liver injury?
It's a very good question, and really depends on which drugs you have, which treatment you have. With the drugs we have now for HCV genotype 1, which is a combination of interferon, ribavirin, and tenofovir, there is a dilemma, which is that the easy-to-treat patients have a borderline indication. So if you decide to treat this patient, you eventually expose them to the severe side effects of the treatment, but they have a very good likelihood of achieving a response to therapy. At the opposite, the cirrhotic patient who needs treatment urgently has a high likelihood of side effects, but a low likelihood of a response. So this is something which is worrisome, complex to deal with, and at the end it is an individual decision with the patient. With the new drugs that are coming, with the all-oral interferon-free regimens, it will be much simpler. I mean, if you have very high sustained virological response rates with little side effects, the cost will be the only limitation, but otherwise you can treat virtually everybody.
And these interferon-free regimens will be probably more acceptable for patients because they will not experience the side effects of asthenia, myalgia, and the syndrome of the interferon. I think that it's one of the reasons why they don't want to engage into therapy, because they feel in good shape with their HCV, and the doctor will prescribe them that some drugs that will pose problem to work and for everyday living.
Yes, exactly. Interferon has been very helpful. We have cured a large number of patients with interferon ribavirin, but this is a treatment that has side effects. It's a treatment which enhances the side effects of all drugs when they're combined together. We cannot say new drugs will have no side effects. This never happens. There are side effects, but I think as soon as we can get rid of interferon, treatment overall will be more tolerable, and this will make it more accessible as well.
So just a last question. I know that you are not a soothsayer, but for you, the availability of interferon-free regimens, at least in large clinical trials, what's the delay? What's the time?
Well, in large clinical trials, it's now. Phase 3 trials are starting with some drugs. Phase 2 trials are starting for others, and we are already including a lot of our patients in interferon-free regimen trials. In clinical practice, I think it will come sooner than we expected before, and I'm again very optimistic that probably a combination will be approved within the next 2 to 3 years.
Okay. Thank you very much. Thank you for this
Thank
very
you.
positive message. Thanks.